Hello, fellow foodies, and welcome back. This is Dr. Cassandra Quave, and you're listening to Foodie Pharmacology, the science podcast for the food curious. Today on the show, we are going to be covering a topic that I know many of you are probably pretty curious about, and that is inflammation. This is something we all deal with, and there are also ways that we can help to reduce our inflammation and our exposure to inflammatory factors in the diet. So, our guest today is Dr. Josh Red. He's the founder of RedRiver Health and Wellness, which is one of the largest functional medicine clinics in the US, with 8 practices in Utah, Arizona, New Mexico, Nevada, and Idaho. Um, Josh has a total of 12 years of post grad education in healthcare, including naturopathic medical training and a master's in human nutrition and functional medicine. He is trained in regenerative medicine and stem cell therapy and does a lot of work also on image guided joint injections. So I'm really happy to have you here on the show, Josh. Great to meet you.
Hey, thanks so much for having me. Great to meet you.
Yeah. Well, let's start with the basics. Maybe you could share with us a little bit about, what is inflammation and why is it important to our body's health and functionality?
Yeah, the inflammation in a short-term setting is fantastic. If somebody has a viral infection or bacterial infection, or let's say somebody gets injured, inflammation will strike up and improve and get rid of or whatever it needs to do to optimize the body's healing process and get us back into homeostasis. However, though, we live this life where we're constantly living this high inflammatory lifestyle, whether it's our food, our environment, our stress, that is causing inflammation to be prolonged and stay consistent. And inflammation over a prolonged period of time can actually be really hazardous to our brain, our intestinal tract, our liver, our hormones, our blood sugar levels, you name it. In fact, we live in an inflammatory crisis right now, and it's really the key driver of almost all disease in our country. And not many people know much about it. We hear the term, but we don't really know much about it.
No, that's great. When you think about the main drivers of inflammation, like for the average American, what would those be? Like what really is keeping us in this state of inflammation?
That's a great question. There's 3 physiological triggers that are really common inflammatory inducers, and then there's a number of different foods, and we can kinda go over those. Physiologically, one of the biggest triggers that we see is too high of estrogen, uh, spurred on by either birth control or other things like that. Too low of estrogen can also be a driver of inflammation. We want to optimize estrogen. And so this is especially bad when somebody's going through perimenopause where we have estrogen fluctuations. Just that fluctuation of estrogen can cause severe inflammation. And this is typically why you see females from about 35 to 55, they'll be healthy their whole lives, and then they reach perimenopause, and it's like a downhill spiral just because of what fluctuation of estrogen does to the body and how much, inflammation that actually causes. So that's one mechanism, and then the other one is actually cortisol defects, which is your stress hormone. The adrenal glands produce cortisol, and when we have unrhythmic cortisol or too high of cortisol or too low of cortisol, that's one of the biggest things that will induce inflammation as well. And then lastly, and one of the most easiest things that we can do, and yet we probably see this with pretty much everyone that we see, is just blood sugar imbalances, which sounds crazy, right? A lot of our individuals and patients that we see, their blood sugar levels are just all over the place. And if we looked at children right now, their blood sugar levels, I almost promise you, is all over the place. When we were eating real food on a consistent basis, our blood sugar levels are just nice and stable throughout the day. But now that we're eating ultra processed foods and absolute garbage, our blood sugar levels just are like a roller coaster. And that is really one of the key drivers for inflammation. We want our patients to use what's called a continuous glucose monitor, and we want to see their blood sugar levels no matter what they eat to be around 80 to 130. But now, almost all of our patients that we're seeing at the beginning, their blood sugar levels drop way below 80 and they spike way above 130. And your body has to compensate with insulin, which causes inflammation. And then at the same time, your adrenal glands, which are your stress glands that we talked about before, have to compensate as well, which causes inflammation and more stress on the adrenal glands. So it's kind of a vicious cycle of problems that happens.
Yeah. Wow. So we're surrounded we have some kind of these innate physiological factors, that women, it sounds like, in particular, face during perimenopause, but also there are some things that are under our control when it comes to diet. So when you think of those foods that probably do the most damage. I've heard of sugar described as kind of like a Brillo pad to your system. I mean, would you agree the intake of all of these additional sugars, especially in, processed beverages,
Yeah, yeah, like, Mark
yeah.
Hyman says it best where he says, "We're getting pharmacological doses of sugar every single day." And that's our children, that's us, that's pretty much everyone, right? We are getting
Mhm.
ultra processed sugars into our diet, and we're getting high doses, and that causes a lot of problems. On top of that, the beautiful thing about my clinics is I own 10 clinics over the Western United States, and we just see a high volume of patients. We see anywhere from about 2 to 300 patients a day who are suffering with severe chronic issues. And so we kind of have our own research center within our clinic, which is cool. We can look at research online, and then we can implement changes, and then we can assess whether that works or not within our patient population. But what we found is we know what foods really drive inflammation and cause problems. We'll test our patients' inflammatory markers, we'll implement the changes, and then we'll retest and see if it made the change or not. And we're pretty calculated with that type of process. But what we see is that gluten and dairy are probably the highest inflammatory foods that our patients eat. They're the most reactive to our patients. Now, that doesn't mean that every patient's reactive to gluten or dairy, but with our patient population, the most common food triggers that we see are sugar, which we mentioned before, and then gluten and dairy. Gluten and dairy nowadays, compared to what it was 40 to 50 years ago, is substantially different. How we create it, how we make it, how we process it, how we store it. And because of all those factors, we now see that it's actually causing a significant inflammatory, overload with our patient population.
Yeah, so I have a question about that because I can look at I mean, you can look at epidemiological data from Europe and they are unabashed consumers of wheat products, of dairy products, of fermented dairy in particular when it comes to yogurts and cheeses, but I can feel the difference in my own body when I spend time in Europe and I'm eating the foods there
Yeah.
versus when I'm eating I've had friends come to the US and really kind of panic because they're like, "Where's the bread? No, where's the real bread?" Because all that we have are these highly processed bread
Yeah.
products. So do you think it's really the gluten, or do you think it's the way that the wheat's being processed, the way that we have different types of stabilizers added to our food products, so it's not truly bread in the same sense that it is in the rest of the world?
A little bit of both factors is
Mhm.
one, unlike other countries, America typically focuses on a few strains of wheat and that's it, because those are the strains that are the most withstanding from the environmental factors. So
Mhm.
that we instead of using a variety of different wheats, we now only use a few, and that causes problems with our immune system and causes immune reactivity there. Research clearly shows that. On top of that, we spray it with glyphosate, which makes it more immune reactive. A ton of glyphosate, right? And then we
So that's
will
that's Roundup, just for folks that are wondering what glyphosate is. Yeah.
Yep.
Mhm.
Yep, so it's sprayed with this chemical, and research shows that it causes our immune system to be more immune reactive. Then when we store it, we'll oftentimes store it for, sometimes up to 2 years, and it will build this mold called an aflatoxin. And even though we remove the mold, that aflatoxin stays on our wheat and is saturating that wheat, and it gets into our body, and that causes our immune system to react. Then you want me to keep going? Then we add folic acid to our wheat, and there's a lot of people with methylation problems where they don't process folic acid properly, and this causes anxiety, restlessness, food intolerances, ADHD, all that stuff as well. Then we take out the protein, we take out the fiber, we add sugar, we bleach it, and that's our wheat. So,
So,
you know,
that's what I'm
is
saying.
it
It's
the
like bread
gluten
is
or is it
not
the
bread
14
here.
other
Yeah.
things we actually do, right?
Yeah.
Um, and it's only getting worse. Like our
Yeah.
gluten has the same nutrient count as a tablecloth, or a tablecloth might actually be less immune reactive because it's not full of sugar and folic acid. But we have that. Then when you talk about dairy, just how we conventionally get dairy now, the things that we do from a hormone and antibiotics standpoint. Now we have younger females who are going through menstrual cycles at the age of like 8 or 9 just because of dairy consumption and hormones. We see that from an epidemiological standpoint is clear within the research that our dairy is gonna be, conventional dairy is different than what you would have, in Italy or places of Europe as well. And I'm the same way where my wife can travel to Europe. She can't eat gluten here. She can travel to Europe and eat as much as she want without any problems. My kids do the exact same thing. I have all of my patients, they always go to Europe, eat as much gluten, spaghetti, pasta, pizza,
Yeah.
whatever they wanna do, and they, like, lose inflammation somehow, right?
Yeah, I also lose weight, and I probably walk more when I'm over there, but I just feel good.
Yeah,
I don't know how I wish I had a way to measure, like, C-reactive protein or CRP and other inflammatory, like,
totally.
cytokines while I'm on the road, but you just know sometimes based on the foods you're eating
Yeah,
how it makes you feel. I mean,
and
this
our
is a
patients
problem, you know?
totally, totally. Our patients, if we'll get our patients to a point, and this is kinda like what my book with the inflammatory reset does as well. We get you
Mhm.
to the point where your body's has is such in an anti-inflammatory state, things are functioning so much better than what they were previously, and when you eat a food that you're reactive to, you'll know within 12 hours. All of your
Mhm.
symptoms of, like, headache or joint pain, depression or fatigue, lack of motivation. We'll have patients that literally gain 5 pounds just in water weight from
Wow.
eating something they react to. And so our patients, they might have 0 to 5 good days a month prior to seeing us, and by the time they're done, they'll have 20 to 25 good days a month. But my point in saying that is that they'll travel to Europe, and then they'll eat something like gluten or a dessert or whatnot, and they have no symptoms whatsoever. Whereas if they do that here, they'll know instantaneously whether they have symptoms or not, right?
Yeah. That's incredible. So, I think one other factor we haven't covered yet is the tie between chronic inflammation and chronic pain. So many people in the US deal with chronic pain every day. Um, what can you tell us about that tie and kind of how diet and inflammation all contribute to the state of chronic pain for so
Yeah.
many?
So from a research standpoint, let's just say disc disease, right?
Mhm.
We can look at a ton of different individuals, and we can do all the proper testing that we need to do. And the individuals will have similar disc degenerative diseases and problems, but the individuals with the pain are the ones with inflammation. The other
Mhm.
individuals don't have this inflammatory component to it, and they have no pain, and yet they have the same type of disc degeneration going on there. And so we kind of see a correlation between if you have inflammation wherever the fire is, it's going to exacerbate it tremendously. And so that when it comes to back pain, joint pain, you name it, inflammation is gonna put, like, gas on a wildfire, essentially.
Yeah. Yeah. Well, I wanna definitely take some time to explore your book, the Inflammatory Reset, 30-Day Inflammation Reset. What kind of motivated you to write this book? Was this really something that you were motivated to do because you're seeing these types of patients and you see things are working? Like, what drew you to write this book?
Well, over the last 17 years, we see so many chronic severe patients that are suffering with inflammatory conditions and autoimmune conditions, and the stories that we hear are absolutely heartbreaking.
Mm,
People who feel like they're crazy, they've gone to 10 different doctors, nobody knows what in the world to do with them, and there's really easy strategies that we can do and implement that can completely change their quality of life. So, for example, I had a patient, one of my first ones, she was struggling with a few different autoimmune conditions. She had been to multiple doctors over the previous 20 years, and her son was asked to draw a picture of her at school, and he drew the picture, brought it home. She pulled it out of his backpack, and she says, and it was her lying in bed.
oh,
And the mom asked, "What's this, honey?" He said, "That's you, mom, because you're always in bed." But, like, that story is heartbreaking, but every single one of our patients almost have that same story. And, um, after all these years of seeing patients from all over the world that are suffering with severe chronic conditions, there's some patients that just can't afford to see us. And so what I did was I took all 17 years of clinical practice and all my research, all my education, and I put it into one book to essentially give back to the community and to the public for those that might not be able to afford seeing one of our doctors to go through a comprehensive process and a one by one process. I created this book specifically for them, and for the most part, these strategies that are contained within this book can play a significant role. I think a lot of times the patients just aren't educated on how to find inflammation, how to test for it, how to address it, and they no longer can depend on their doctors to do that for them. They have to take control of their health. They have to be the expert in their health. They can't depend on their doctors dictating their care and telling them what to do, and all that stuff. And so,
Mhm.
really, that's the purpose of why I, created this book and wrote this book, and yeah.
So, what are some of the symptoms of kind of chronic inflammation? Like, how would someone know that they might need to have an inflammatory reset? Like, what are
Yeah.
what might you be looking for?
It presents differently to the population. So, for example, a standard person might have joint pain, intestinal issues, gas or bloating, or depression or fatigue, maybe just being tired throughout the whole day. That could be a sign of inflammation. For females, like we talked about perimenopause before, for females, inflammation makes perimenopause symptoms way worse. For males, it causes aging and makes it way worse. In kids, this is kind of like where the scary and frustrating thing is. For kids, it could present as ADHD, neurobehavioral issues, developmental delays, performing really bad at school, acting out, things like that. And in reality, like we might see these kids and think, oh, they're just not performing like they should. They could be literally inflamed and their brain could be inflamed. And what's frustrating is that by the time we become 25, if we haven't corrected the inflammatory process within our body and within our brain, the brain doesn't develop and stops developing. And all the problems that we have at that point stay with us for the rest of our life. And so, even more so as parents, we have to do things to step up and do all that we can to help improve these kids' lives and start to change things quite drastically because these kids are living a significant inflammatory lifestyle. They eat, pancakes and cereal for breakfast, which spikes blood sugar levels and
Mhm.
spikes inflammation. Then they go to school and they have maybe chicken nuggets and milk for lunch, and then they
Ultra
go home.
processed food, ultra
Yeah.
processed at the school.
And
Yep.
then who knows what they have for dinner, but then we wonder why our kids act out or why they aren't performing well or why they're not developing properly or why they have, mental illness or why they have other issues, and it could be because their brain is literally on fire, and we're
Mhm.
not doing anything to address the actual mechanism driving these, kids' problems, and it could be something as simple as doing some of these simple things that could drastically improve their quality of life and then help set their future up, for the rest of that time.
That's great. So out of could you give us some examples of some of the steps that you advise in your book? Like, is it a change in diet? Is it change in physical activity? Is it sleep? Like, what are you kind of advising people to do
Yeah,
if
it's
they
a
wanna
little bit of
reset?
everything. So,
Mhm.
uh, the cool thing is kind of like 2 books in one. So the first part's all literature. We go over, what causes inflammation. We go over environment. We go over dietary stuff. We go over stressful situations. We go over trauma. We go over pretty much everything that can induce and cause inflammation. And then we explain what we can do to get it to improve. And then on top of that, we go over the neurological inflammation, what causes brain inflammation, how to improve brain inflammation. And then we explain how to improve it from a dietary standpoint, from a lifestyle standpoint, from an environmental standpoint. We break all that down to try to make it as easy and simple as we possibly can. And then we show you, the last half is essentially a cookbook that shows you a ton of different recipes that you can do for breakfast and snacks and lunch and snacks and dinner. And it breaks down simple, easy ways that we can eat that can be anti-inflammatory for us. And it goes through a process for 30 days. If you eat this way for 30 days, um, it goes through the process of kinda holding your hand on how to eat this way for 30 days, and then what to do after the 30-day mark, because you'll be restricting foods for the first 30 days, but after that, you can add foods in rapidly from that point on, and you can kinda see what foods you specifically react to versus what other patients react to. Everyone has kind of a different, physiology standpoint there, and one patient's different from the next patient, and they
Yeah.
might react to foods that another patient doesn't, but we break that down step by step for the readers to follow along and to, go that route, so
Great. So it's really kind of relying, in this case, not on lots of biochemical assays, but how their bodies feel after you pull certain inflammatory foods out. And if they're gradually reintroduced, you can feel the difference. Kind of like what we
yeah.
were talking about when
Yeah.
I'm in different countries, like, you feel the difference in how your body
Oh,
performs with different foods.
yeah,
Yeah.
100%.
Yeah, I think it's important, like, so much of education, I feel like, at least in early childhood nutrition when I was a kid, was like, "Food is fuel." I'm like, "But if we're putting bad fuel in our bodies, this is it's so much more than fuel."
It
It's all the parts, it's how we keep the parts
yeah,
up to date.
yeah.
Yeah,
It's a great point. The food that we eat can either be our best form of medicine or our biggest detriment, right, for
yeah,
our overall health. Every single thing that we put in our mouth impacts our immune system, impacts our biochemistry, impacts our intestinal tract, impacts our hormone, impacts our brain, impacts our blood sugar levels, right? The
mhm.
food that we eat is making a biochemical exchange and making a biochemical difference in every single aspect. So it's either going to help aid us to health or it's gonna really just be a huge detriment to our, to illness, really.
That's great. Well, are there any other kind of key points from the book that you'd like to share with folks? Like, or any, if there's like one lesson you'd like our listeners to know, what would that be?
Well, for me, this is obviously a deep dive into inflammation. But what I like to do with my patients and just individuals that I talk to is you can start by just improving one thing in your life. You don't have to do the whole 30-day inflammatory reset, or you don't have to do this for the rest of your life. But what you can do is you can identify one area that you can improve on and make that change. And that's easy. Everyone can make one change, right? And then as you master that one change, you can add another change. You could start with, okay, I have an autoimmune condition or an inflammatory condition. I'm going to stop eating gluten just because that's one of the biggest triggers. And as you master that, I mean, there's lots of ways that, there's so many gluten free options and, easy swaps that we can make that make being gluten free pretty easy if you understand what gluten free means. And then as you make that change, you can slowly make another change. Something as simple as household products. Instead of using conventional cleaning products, you could use healthier versions, or something as simple as taking your shoes off when you walk inside. It sounds crazy, but that can improve inflammation.
Really? How
Um,
tell me more about that because I am always on my kids and my husband, "Take off your shoes." I like to have a shoes off house because I just think of all the stuff that we step on out in the
yeah, no,
world,
no,
and,
you're
like,
right.
I like to
Yeah,
be barefoot at home, and if you're
yeah.
walking with all that yuck, so tell us more about that.
Yeah, so, it's amazing what we can actually track inside if we continue to wear our shoes, and we can track that around our house. We can track in mold, we can track in bacteria, viruses, we can track in a ton of different things that can actually be impactful in a negative way to our health, and research is extremely clear on this. If we just simply take off our shoes, it decreases the environmental toxins within our house, just that one simple
Wow.
change. So, everyone can have a no shoe policy. That's pretty simple, right?
Yeah,
And it's
I love
probably
it.
a lot better for those that actually clean the house too. But, it's also having an impact on our health.
That's great. Okay, I have a new argument I can use at home. It's like, it's not just about keeping the floors, like, having to sweep less.
Totally,
That's
totally.
great. That's great. Um, Fantastic. So oh gosh, and I had another question about inflammation. Maybe you could expand a little bit more about the types of inflammatory diseases that people can develop when you're in this state of chronic inflammation. And maybe also talk a little bit about antioxidants and how those kind of play into the inflammatory process. That
Yeah.
those might be
Yeah.
helpful for people
Yeah,
to
that's great.
understand.
So
Mhm.
So here's the deal. There's a ton of diseases that are inflammatory driven. Diabetes, cancer, autoimmune diseases is one of the biggest ones, right?
Mhm.
Almost 20% of our population has some form of autoimmune reaction that's happening, which is absolutely absurd. And females get the brunt of most of that.
Yeah.
Um, Even reproductive type issues can be driven by inflammation. Hormonal defects can be driven by inflammation. Autism, which is obviously multifactorial, and we want to be sensitive about how we talk about that, can be driven by inflammation. We see there'll be a lot of patients that are suffering with autism, and it's almost likely every time that their parents might have some type of autoimmune condition. Um, and so these inflammatory and autoimmune diseases can translate and just speed up and get worse and worse and worse. And then the sad part too is that once you have one autoimmune condition, if you don't calm down the inflammatory process and you're just treating symptoms with pills, it can turn into other autoimmune conditions as well. And so getting on top of this as best as you can and trying to calm down this inflammatory process can save you so much hassle and so much heartache down the road for sure.
That's great. And when it comes to the types of foods, I'm assuming I haven't had a chance to go through the whole book yet, but I'm assuming you also talk about whole fruits and vegetables,
Yeah,
things that
yeah,
eat the rainbow kind of stuff, right? Because 'Cause you're
totally,
looking at
totally.
antioxidants. How do those kind of play into this?
Those are really important because as you said, eat the rainbow, we're actually changing our gut microbiome and we're causing our immune system to become more resilient, which is fantastic. So we see patients where they're so reactive to so many different foods that they only eat like 4 of the same foods pretty much every day. And that's actually bad for the intestinal tract. There's ways to where you can eat a variety of vegetables and fruits, and it can have a significant impact on the gut microbiome, and then it can improve your immune resilience, which will allow you to not be reactive to food as many foods down the road too. From an antioxidant standpoint, to answer your question before, a lot of the inflammation is driven by what's called Th17 cells and other inflammatory mediators. And if we were to do like ibuprofen, for example, or
Mhm.
Advil, that decreases one inflammatory mediator. And there's actually 100, right? And
Yeah.
so what's fascinating is that antioxidants, let's say, for example, resveratrol or liposomal turmeric, those actually touch on 30 different inflammatory mediators, whereas ibuprofen only touches on one. So, your fruits and vegetables can have a significant impact on antioxidants and inflammation in general. And they're not just touching on one, they're touching on multiple inflammatory mediators, which is really cool. So I love talking about food and nutrition and botanical medicine to help calm down inflammatory mediators. You can gain a lot of ground just by simply doing that.
Amazing. Well, Josh, where can we send people to learn more about your book and about your clinical practices? Like, do you have a website you
Yeah,
can share
yeah.
with us?
Yeah,
Mhm.
so you could go to the 30-day inflammatory reset on Amazon,
Mhm.
or it's in Barnes& and Noble all over the country, and then, you can go to RedRiver Health and Wellness.com. That's our, functional medicine clinics that mainly deal with autoimmune conditions and inflammatory conditions, and then I have a longevity and stem cell clinic called Palma Vida in Spanish Fork, Utah, where we see athletes and people from all over the world that come and get orthopedic stem cell injections, which is so fun and kind of a whole new realm of health. But yeah,
Amazing. Well, this has been super informative, and I'm very appreciative of the shoes off policy, so I can use that
well,
at
let
home.
me know how that goes. Send some
Yeah.
pictures when that changes. Maybe just feel your husband's reaction when you tell him
Yeah.
that.
Exactly. It's for my health.
I love it.
That's all. Great. Well, thanks so much for coming on the show, Josh. It was so great to meet you.
Thanks for having me. I really appreciate it.
Yeah. All right, you've been listening to Foodie Pharmacology, the science podcast for the food curious, recorded for you today on Restream. I want to thank our producers, Rob Cohen and Christine Roth, for making this show possible. We are in season 8 already. Been an incredible journey. If you want to help out the show, you can head over to our website, buy me a coffee. I need some more caffeine to keep the show going. But every buy me a coffee donation helps us cover production costs and keep the show coming out to you all. Again, season 8, lots to celebrate. So, thanks so much for listening. Stay healthy out there, and we'll see you next time.